everyone. Welcome back to the Medicare Space channel. My name is Victoria Cabrera, Medicare insurance agent, bringing you some information, getting back to the foundation of health insurance and how all the moving parts work. So even though I normally talk about Medicare, I still want to get back to talking about some of the terms that we use in insurance. And today what we're going to talk about is a PPO. What is a PPO? How does a PPO work? Okay. And before we go on, be sure to hit that subscribe button down below so that way you can get the latest information from me if you have any questions or concerns. With a PPO stands for a preferred provider organization. These plans are usually less restrictive than an HMO plan. Okay, with these plans, they have what's called in and out of network benefits. With a PPO, you don't typically have to have a primary care assigned. It is recommended to establish a primary care doctor, but you're not having to be assigned a primary care doctor. And also another benefit of a PPO is that there's no referrals required. So unlike an HMO, you have to be assigned a primary care doctor. You have to get a referral if you do want to see a specialist, okay? With PPO plans, you'll see it a lot in Medicare Advantage plans. You usually have options of a PPO, of an HMO, and so when you're trying to choose between the two, you have to remember the main differences, okay? So a PPO, they are less restrictive, meaning more extensive network, okay? So no PCP required. And there's no referrals required. Excuse my spelling and my handwriting. I'm going really fast here. Okay. Another benefit from a PPO is that they have what's called in and out of network benefits. So how this is going to benefit you is, let's just say that you have quite a bit of specialists that you see. You have about 5 specialists that you've been seeing for a very long time. You don't want to switch those specialists. You've established the care. With the PPO, this might be the better option for you versus an HMO because you're not required to get the referrals to see your specialist. If you would like to schedule an appointment, you can schedule an appointment without having to see the primary care doctor first. There's also what's called in and out of network benefits. In network benefits, if you stay within the network of providers within that PPO network, what will happen is your medical costs, your out-of-pocket costs are lower. If you do decide to go out of network with doctors that are not within the network, the plan will still allow you to see those doctors. However, guess what? The cost of the care is going to be higher because you're out of network. So there's some differences between an HMO. If you didn't get to watch the HMO video, go ahead and click that video there so that way you can go ahead and watch the HMO and how those work. But if you just remember these few things, you don't have to make it super hard, okay? It's a less restrictive plan. You're not required to establish a PCP. However, it's always recommended. There's no referrals required, and you have those in and out of network benefits. Just keep in mind when it comes to PPO plans, the copays are a little bit higher. The deductibles might be higher within the plan. They're not going to be as rich in benefit as an HMO would be. But again, like I say in every video, there's always a give and take. So it just depends on what your situation is. If you have quite a bit of doctors, if you're on Medicare, you have quite a bit of doctors, I would probably recommend going with the Medicare supplement if you're able to get into a plan with the Medicare supplement. If you're unable to pass underwriting with the Medicare supplement and you need the next best option, it's going to be the PPO. Okay. So if there's any questions, my name is Victoria Cabrera. Go ahead and email me. My email is down in the bio below. If there's any questions, you can also text me, call me, whatever you prefer. Thank you so much. Be sure to subscribe and go ahead and hit that next video. Thank you so much.